story highlights 18 states permit non-medical exemptions from childhood vaccinations. The risk of outbreaks is rising in 12 of them. New research finds, CNN, a number of American states and metropolitan hotspots are vulnerable to outbreaks of vaccine-preventable disease. New research suggests the reason: children whose parents opted out of vaccination. The risk of outbreaks is rising in 12 of the 18 states that permit non-medical exemptions from childhood vaccinations, according to a study published Wednesday in the journal PLOS Medicine. Those states are Arkansas, Arizona, Idaho, Maine, Minnesota, North Dakota, Ohio, Oklahoma, Oregon, Pennsylvania, Texas, and Utah. Over the past decade, these states have seen a rise in the number of non-medical vaccine exemptions represented by children entering kindergarten without their shots, said Drive. Peter Hotez, a co-author of the study and dean of the National School of Tropical Medicine at the Baylor College of Medicine in Houston. Vaccines fast facts: this is a wake-up call, he said. Certain hotspot metropolitan regions also show a high proportion of non-medical exemptions and so may be especially susceptible to outbreaks: Seattle and Spokane, Washington, Portland, Oregon, Phoenix, Salt Lake City and Provo, Utah, Houston, Fort Worth, Plano and Austin, Texas, Troy, Warren and Detroit, Michigan, Kansas City, Missouri, and Pittsburgh. High numbers of unimmunized children living in large cities with busy international airports may contribute to the risk of a swift spread of disease, according to Hotez and his co-authors. Measles outbreaks in the U.S. are usually started by people when they become sick while traveling to or from a country where the virus is endemic. Read more. The scientists also identified a few smaller counties in Idaho, Wisconsin, and Utah with troublingly high exemption rates. Overall, Idaho has 8 of the top 10 counties with the highest rates of non-medical vaccine exemptions. The low end of this range is nearly 15% of the kindergarten population having a non-medical vaccine exemption in Morgan, Utah, to 27% in Kamas, Idaho. Other top 10 counties include Bonner Valley, Custer, Idaho, Boise, Kootenai and Boundary, Idaho, and Bayfield, Wisconsin. An autism dad and his fight. I'm a vaccine scientist, but I'm also an autism dad trying to fight this anti-vaccine movement at a very personal level, Hotez said. Anti-vaccine advocates often argue that autism is caused by vaccines, yet this theory has been debunked. Minnesota measles outbreak exceeds last year's nationwide numbers. Hotez and his colleagues found an increase since 2009 in the number of children enrolling in kindergarten with vaccine exemptions for philosophical or other non-medical reasons in 12 of the 18 states that allow them. This study does not explore the reasons why only some of these states have rising rates. States where a higher percentage of parents exercise their right to a non-medical vaccine exemption should lower coverage rates of the MMR vaccine in particular, this study finds. The MMR vaccine, which is given to children in 2 doses at 12 to 15 months old and 4 to 6 years old, protects against the measles, mumps and rubella. Dr. Sanjay Gupta. Benefits of vaccines are a matter of fact. We had a terrible measles outbreak in Minnesota last year, Hotez noted, adding that vaccination coverage in 90% to 95% of all children is needed to protect against highly infectious diseases. Marin County, California, and Orange County, California, have very strong anti-vaccine sentiments, he said. In fact, the state had lenient vaccine laws that allowed for philosophical exemptions prior to a 2014-15 measles outbreak in Anaheim, a city located in Orange County. Subsequently, in 2015, California voted into law a regulation against such non-medical exemptions, which were seen as a contributing factor in the outbreak. Between 2016 and 2017, the number of kindergartners with non-medical exemptions dropped to the lowest rate the state has seen in over a decade, Hotez said. California wasn't included in the new study because they already closed that door. His concerns extend beyond America's borders. I'm worried this European-American-style anti-vaccine movement is going to move into the global south, Hotez said. What we're seeing in Europe right now, with horrific measles outbreaks across Europe, could also begin in the U.S. as well. He noted that with more than 10,000 cases of measles in Ukraine this year and higher than usual rates in Romania, Italy, Greece and Germany, 2018 will top last year's total of 20,000 measles cases across Europe, he said. Measles tripled in Europe in 2017, European CDC reports. Starting in 2000, we put in place Gavi, the Global Alliance for Vaccines and Immunization. It's done a terrific job of lowering death from childhood infectious diseases like measles. That's been an incredibly successful organization, Hot has said. I worry we're going to start eroding those gains. Possible solutions. The new study is a good contribution to the field, said Sudhbhi Gavi has brought down measles deaths by 90% from over 600,000 to over 70,000. Omer, a professor of global health and epidemiology and pediatrics at Emory University. Omer, who was not involved in the research, said one strength of the work is that the researchers conducted an in-depth analysis of individual states with non-medical exemptions, which had never been done. Omer's own research has shown that states with philosophical exemptions had both higher rates of refusal and higher rates of disease. His study focused on rates of whooping cough. Clusters of refusal overlap clusters of outbreaks, he said. Mumps outbreaks linked to waning vaccine protection. Study says, however, if it's difficult to obtain an exemption, then you have lower rates of refusal and lower rates of disease, he said. We established that framework and established that data. In another study, he and his colleagues showed that rates of vaccine exemption were rising faster in states that allowed exemptions for philosophical beliefs. More recently, the new study is important, then, because it looks at the states where this general national trend may not be happening. At a national level, we saw a plateauing of vaccine exemption rates, Omer said. The good news is that the policy option that is more viable for most states, essentially making it less convenient for parents to not vaccinate their children, has actual impact on rates of refusal, Omer said. In Washington state, he noted, a law requires parents to be counseled by a physician about vaccinations before they can receive an exemption for their children for non-medical reasons. Follow CNN Health on Facebook and Twitter. See the latest news and share your comments with CNN Health on Facebook and Twitter. Just by adding that law, he said, Washington saw an approximately 42% reduction in the rate of exemptions. In California, before the regulation against non-medical exemptions became law as a result of the Anaheim measles outbreak, there was a tightening of vaccination exemption requirements that helped reduce refusals, he noted. Such incremental changes could have positive effects across the country, Omer says.